Hi, everyone, and welcome to this special edition of the CPH Book Club. My name is Gillian Plott. I will be acting as host, and today we are honored to have Vinny DeMarco, the subject of the DeMarco Factor, our current CPH Book Club read. A powerhouse in public health advocacy, Vinny has spent 20 years organizing campaigns in Maryland. He has led successful efforts to pass gun control laws, to spearhead major campaigns like increasing Maryland's cigarette and alcohol taxes, expanding healthcare to hundreds of thousands, and passing gun safety laws. Joining him is Dr. Glenn Schneider, Senior Associate at Johns Hopkins Lerner Center for Public Health Advocacy and Chief Program Officer at Horizon Foundation. With 30 years of experience, Glenn has successfully led advocacy campaigns that have generated more than 40 state and local laws. Together, Vinny and Glenn will talk about the DeMarco Factor, offering deep insights into grassroots coalition building, media savvy campaigning, electoral strategy, and turning public will into policy power. I now would like to introduce the two of them to have a conversation.
Thanks so much. Hello, everybody. So excited that you're taking a little bit of your summertime to be with Vinny and I. And I couldn't be more pleased to have an opportunity to interview Vinny. For those of you who didn't realize, I have worked with Vinny for many years. I think we're now more than 30 or close to 30 years together. And I have had the great pleasure and experience of working with Vinny both inside the organization, outside the organization, and now as a board member for the work that's done at Maryland Healthcare for All. So I'm excited to be interviewing Vinny about this book. And I am certainly humbled to say I have some ink in that book as well. And we're going to talk a little bit about the work that Vinny has done over all of these years. So Vinny, let's get right into it. Let's talk about before the strategy, before the coalitions, before the legislative victories. Who was Vincent DeMarco as a young man? And what stirred your passion for public health advocacy?
Well, first of all, thank you, Gillian, for having us. And Glenn, I'm a big fan of yours. You are a wonder of the universe and a gift to the world. And we were all thrilled when you became a PhD doctor to recognize your brilliance. So thanks for all you do for so many people at the Horizon Foundation and on our board as our treasurer in so many other ways. Thank you for talking about the DeMarco Factor book. It was written by Michael Perchik, a great public health leader, former FTC chair. And to answer your first question, let me just say I was born in Italy. We immigrated to the United States when I was 4 in 1961, and my parents very quickly instilled in me, you got to do for others. And that was something that all of us grew up on. And then in addition to that, I just developed a deep love of history. I was a history nerd in every way you look at it. And my real passion were for people like Eleanor Roosevelt, Robert Kennedy, Martin Luther King Jr., who really devoted themselves to making life better for others. And the more I read about them, the more I listened to my parents, the more I knew that that's what I wanted to do. I wanted to spend my life making the world a better place. And I enjoy being with people. I enjoy talking. I enjoy, so I kind of realized, and it was true, that following my passion would also make me happy.
And the book details a whole lot about how from that very beginning, even when you were exchanging time with the mayor and all the other sort of stuff to be able to pass your own smoking ban in school at the time, that was a big deal. So it's great to hear that that's sort of how you got your start in all of this. It started young. Your why was important. The why you did this work, you wanted to be a change maker like all the rest of those great people that you mentioned, and you have been. So in the book, there are many reviewers who have talked about how you have created a new replicable model for how you make things change for the better through policy work. If you could boil down everything in the book, take the whole book and boil it down into its core components, what are they? What are the things that you could boil down for all of our listeners today that kind of encapsulate all of it?
Well, I think I've learned two fundamental lessons over these 30, 40 years of public health advocacy. I'm an old man. And one is that no matter how intractable you think a problem is, no matter how intractable you think a public health problem is, there almost surely is a brilliant mind like Glenn's or someone at a school of public health somewhere who has come up with a smart evidence-based solution to it. There almost always is such a solution. Lesson number 2 is that the vast majority of people support these. And if they knew about these solutions, would support them, and that there's broad public support for public health. But not everyone, and I, like many of you, come across people who don't like this. One guy said to me, "You're the one who came after our guns in my neighborhood. Now you're trying to take my cigarettes. Next thing I do, no, you're going to come after my ham." Well, I told him we would leave his ham alone. I didn't tell him he was a vegetarian because he probably would have shot me. But the fact is, there are people like that who are against us. But the real problem is vested interests with lots of money who block public health measures, even though they're evidence-based and even though the public supports them. These people like the tobacco companies, the alcohol lobby, drug industry, climate polluters, they have a lot of clout in our state capitals and in Washington, and they block these public health measures. So over the last 30 years or so, since the mid-90s, working a lot with Glenn Schneider and others, we came up with a 6-step approach to dealing with these situations where you have a public health problem. The solution is out there, studied and written out. You have broad public support, but you have an obstacle, a major vested interest opponent to it. And those of you who may have read the DeMarco Factor book will have seen a kind of description of 6 steps on page 150, I think it is. It's a little different than what I'm about to tell you, because it was only after the book was published that a light bulb went in my head and said, these are the real 6 steps. But let me just say what these 6 steps are. You could all find them at healthcareforall.com/6 steps. Step 1 is find your evidence-based solution. Go to the experts at the Johns Hopkins Bloomberg School of Public Health, University of Maryland, wherever, and come and find whether it's a $1 increase in a cigarette tax, reduce teen smoking, increasing the alcohol tax, licensing handgun purchasers, prescription drug affordability board, whatever it is. There is an expert who's come up with a solution, and have that expert help you show how that solution would help people in your jurisdiction. Make it personal. Second, do polling to test public support for your specific solution, not for the problem overall, whether people think about it, but your specific solution. Do you support licensing handgun purchasers? Do you support a prescription drug affordability board that could put upper payment limits, a $1 tobacco tax, whatever it is? And then ask 3 questions. Always ask 3 questions. Who are you going to vote for in the next election, a Democrat or Republican? Straight up generic question. Question 2, if the Democrat supports your plan and the Republican opposes it, who are you going to support? Question 3, what if the Republican supports it and the Democrat opposes it? Who are you going to support? Each of the issues we've tested, we found voters moved. We found that voters became more supportive of the candidate, whether a Democrat or Republican, who supports these issues. And that showed us that we could use these 6 steps, that the public will is there, and we go forward. In addition to kind of polling, do focus groups to test messages. On drug policy, we found the best message is drugs don't work if people can't afford them. And you test messages like that, and then you have a very solid step 2. Step 3, I like to call the backbone of this work, and that is building a broad coalition. You can't just be public health people versus the evil empires. You will lose. They have a lot more money, and I see it over and over again. Public health people saying this will save lives, and that's just not enough. So you got to step back and maybe ignore the legislature for a while, or your policymakers, and think about how to broaden your coalition. And we do that with a 1-page resolution. I insist on 1 page so that everybody can get their head around it and not think, oh no, I have to read 10 pages, whatever it is. And in that 1 page, describe the problem and how your proposal will deal with the problem. And we spend years, ladies and gentlemen, getting hundreds of organizations to endorse these proposals. It takes time. It takes patience. It takes answering questions, but you really build a strong base. And then step 4 is use the media to the hilt to get the message out. And I know, as Glenn, everyone who knows me knows I'm a nudger beyond belief, but I can't nudge 6 million Marylanders. So we need the media, earned media, social media, paid media, every kind of media to get your message out. And step 5, which I want to emphasize here, is where you make it an election issue. The successes we've had in Maryland, which are pretty significant, including beating some of the most powerful interests in our state and in our nation, happened because we made these issues an election issue. At election time, we forced the candidates for office to take a position. We sent them that same document all those coalition partners signed and said, by this date, you need to sign that, or we're going to let the people know who has signed it and who hasn't, and you're going to suffer. And over again, we found people who, while they were in the legislature, far away from us and far away from the public, did whatever the tobacco companies wanted or the drug companies. When the public was engaged and the public was watching, are they going to sign this or not? They signed it. And then you let the public know who has signed it and who hasn't. And that is the crux of overcoming some of these powerful interests. And then after that, you still got to do step 6, and you still got to go to the legislature. Even if you did steps 1, 2, 3, 4, and 5, you still have to have a great hearing. You have to keep the media happening. You have to keep the calls and letters going. But if you haven't done steps 1, 2, 3, 4, and 5, you'll often be banging your head against the wall forever. But if you do those steps, then you get it done. And ladies and gentlemen, when you pass the bill, don't forget 2 very important things. Number 1, say thank you. Legislators are people too. They hear it when people don't like what they do. They don't often hear it when you like it. Say thank you. They'll remember that next time you want to talk with them. And second, work on implementation. Don't forget that the government isn't going to do it all well by itself. You have to help them get the message out about a new Medicaid coverage, about how to implement these laws. So you do all those things, and those are the crux of what's outlined in the DeMarco Factor book.
I love it. I love that nice summary there. The 6 steps available again. What's that website again, Vinny? What's that website?
Healthcareforall.com/6 steps.
There you go.
Healthcareforall.com/6 steps.
Okay. So let's talk about a nuanced part of this, Vinny. We were going down, as I remember, going down the road to Southern Maryland. There's a 3-hour trip. And we were talking the whole time about what makes the work that we do successful. And we came up with this thing called the rule of the thirds. I have always found it useful in my work in changing community to really talk about this, because I've always thought it being fundamental to the work in successful work that happens. So can you describe what the rule of the thirds is from our conversation? By the way, I think that was on page 105 or something like that. Yep, in the book.
I can modestly say that it was a brilliant concept came up with by Glenn Schneider. So
that is not true. It was the both of us. We were riding in the car.
We came up with it together. Well, look, the rule of thirds simply says that the public, and I think this applies to legislative bodies also and everyone else, on any major issue like this, is basically comprised of 3 kinds of people. Those who are forcefully behind you, who really want this to happen, what you're proposing, and will go to the barricades with you, we'll make the calls, we'll go to the rallies, we'll do everything. Then there's the third who just hate what you're doing, and they're against you, and they're going to come out against you, and you're going to have to deal with that. And then there's the critical third in the middle that support what you're doing, but aren't going to come to the barricades and go to the rallies and everything, and aren't as enthusiastic about your goals, but want to make it happen. And you have to very carefully, when you're building a campaign like this against a powerful vested interest opponent on something like this, make sure that you propose something which will juice up your third that supports you without turning off the people in the middle. And the DeMarco Factor book talks a lot about on healthcare. We learned from our polling, the vast majority of Marylanders want healthcare for all. But if you say, do you want one healthcare system, one single payer healthcare system that everybody's on, that support drops to about a third because There are third in the middle who want healthcare for all, but want to keep their own present healthcare system. So we came up with a plan that I think really effectively mobilized the third who are really for healthcare for everyone and want to go to the barricades with you, and the third in the middle who are for it but don't want to be taken off their healthcare plan or will essentially stay out of it and be supportive but not oppose you. If you got the third in the middle opposed to you, you're dead. But if you get the third in the middle at least neutralized with the third who's with you, you can succeed. And it's a strategy which I think works on many issues, gun violence prevention and so much else. The important thing is to have a plan which saves lives and is strong enough to mobilize that third in the middle without turning off, mobilize the third who's completely with you without turning off the third in the middle.
No, thanks, Vinny. I think that's always been critical in my work as well. Let's talk about something you said a little bit earlier, which I think is really important for folks to think about. We were talking about the reasons that grassroots campaigns typically fail is because folks go automatically to lawmakers that they think hold the power to make change. So they go to them first. You mentioned something about if you didn't do all those other steps, that is completely wasted time and wasted effort because you're never going to win typically. Anything more that you wanted to say about that?
Yeah, I want to emphasize over and over again in Maryland, there were efforts to raise the alcohol tax. The alcohol lobby is one of the most powerful lobbies in Annapolis and in any state capital. The alcohol tax hadn't been raised since the 50s in Maryland, when for years they were trying to do it. And the beer tax since the 70s, wine tax since the 50s. It was terrible. And it was really too low. And advocates would go to Annapolis and say, we need to raise the alcohol tax to raise money for these purposes. But the alcohol lobby was just too powerful. So we stepped back to build this powerful coalition. So the next time when we went there in 2011, they weren't just hearing from the advocates. They were hearing from the faith groups. They were hearing from the unions. They were hearing from business leaders. They were hearing all these folks. And I want to emphasize this, in 2010, they heard it from the people at election time. We made it an election issue so that the voters elected people who supported raising the alcohol tax. Now, you may be asking out there, while you're doing all this public stuff, where are your vaunted opponents? What are they doing all this time? Well, my vaunted opponents, and some of them are my friends, I like to compare to cockroaches because they do great in the dark when people aren't watching in the halls of Annapolis or Washington or wherever your state capital is. They're very powerful when nobody's watching, but we turn on the lights. And what happens when you do that? The cockroaches scatter. When we were doing our press conferences about the benefits of alcohol tax, or tobacco tax, or handgun purchaser licensing, there were no really opponents out there. We had the field to ourselves.
Thank you. And I want to go off script with one question because you mentioned the idea of how important media is. A lot of folks know that the media world is changing right now. How do you think is the best way to be able to get the media to cover the work? You have been always very successful at getting media to cover the work that's being done. What's the very quick way to think about that for folks who don't typically do that?
Relationship. Build strong relationships with the reporters. Be there for them when the newspaper or TV station gets a new reporter on healthcare. Be one of the first people who goes out to lunch with them. Know them. Be there for them. I just had lunch today with a new Washington Post reporter talking about healthcare issues. You've got to build those relationships so you're the one they want to talk with and they trust you. And have a good message. Drugs don't work if people can't afford them. Tobacco taxes save lives. Have good message. And third, have good messengers like faith leaders and others who people will listen to. Now, that all works for what I know. What I don't know is social media. There's a little bit of that out there. What I'm smart enough to know, there are people like my colleagues, Suzanne, Stephanie, Catherine, who really know social media, so they do it because I don't know it at all. But you gotta stay up with the media and you gotta build those relationships.
Love it. Thanks, Vinny. So let's talk about this. We have a few more minutes of questions that we're going to ask, then we'll open it up to all of you here. But So make sure you're putting your questions in the chat there. So, Vinny, you've had a lot of successes, a lot of great successes. I mean, raising tobacco taxes, expanding healthcare, regulating gun violence, all that sort of stuff. Is there any one victory that meant the most to you personally? Something that you came across feeling like, oh my gosh.
Well, looking back, I just love the trifecta of 2019. In 2019, we got enacted the first in the nation prescription drug affordability board law, which is now taking effect to make high-cost drugs more affordable. The first in the nation easy enrollment law to allow people to enroll for healthcare at tax time and other times got subsequently amended. And those are being replicated all across the country. Our wonderful Senator Chris Van Hollen has put in national models. And working with my son, Jamie DeMarco, we enacted the Clean Energy Jobs Act to expand the percentage of Maryland's energy that's renewable from 30% to 50%. And I'll tell you, all those victories happened because we made these an election issue in 2018. So that year and those successes, I think, are to me, the number one. They saved so many lives and made the world a lot better place.
I love it. But you've also had some share of losses as well, or setbacks. I wouldn't ever say that we had losses in that way. We've always come back to look at them differently. But, let's talk a little bit about that. What was the most painful setback in your advocacy career, and how did you recover from it?
Well, probably the most painful setback was in 2002 when Kathleen Kennedy Townsend, the lieutenant governor, was very supportive of her. Now, we are a nonpartisan organization. Democrats and Republicans, we want all of you to support us. But in this 2002 election, the Democratic lieutenant governor incumbent, Kathleen Kennedy Townsend, was very supportive of us. The Republican opponent, Robert Ehrlich, was opposed to what we were doing, and he beat her. We were shocked. I just remember all of us were in shock. Should we continue in business? What should we do? And we had a huddle and think about, what does our coalition want? What can we go forward? And we decided we just had to go forward. The public wants healthcare for all. We have a plan to do it, and we're going to do it. And you'll remember, Glenn, with me, one day into the Ehrlich administration, one of his chief aides said, we need healthcare for all. Suddenly, I got all these calls from reporters. Hey, you got a plan? Yes, we have a plan. So, but it was very devastating when Kathleen Kennedy Townsend lost and Ehrlich won. But we survived and continue to make progress.
And how did you personally overcome some of that? Because as I recall, you were feeling at some point during that time of, maybe I need to separate. Maybe I need to do something else. You eventually came around, but how did you get to that point?
Well, a lot of it was thanks to you, Glenn, and your support and
that was not a plant question.
Was,
no, I really want to know,
sure.
what was it really?
No, I'm very honest. You and Rosanna, Suzanne, Matt, and the others, and my wife Molly, who really stood behind me and made clear to me that we have the right way to do this, and we can overcome this problem, which we did. And I mentioned my son Jamie, who's now working on climate issues. He was also, both my sons, very supportive of my continuing. But I'll forget it. Around the same time, we lost a major vote in Annapolis by one vote to expand Medicaid and coverage, and it was so sad. And I remember coming home and saying, Jamie, I can't believe we lost. And Jamie said words which are in the DeMarco Factor book. Dad, you won, just not yet.
Yeah.
And that helped a lot.
That's always such a powerful part of that book. I agree with you. When what comes out of the mouth of little kids.
Yes.
So true. And thinking about this, Healthcare for All has been a place where we have always welcomed interns to come through the office, whether they be in high school or college or anything else. What qualities do you look for in the next generation of advocates? And what advice would you give to young people, particularly for entering the world of public health or social justice work, given the times that we're in?
Well, my main advice is follow your passion. I mean, where your passion leads you, and everybody has different influences on them. When Robert Kennedy and Martin Luther King Jr. were both assassinated, I was so devastated, and it was put deep inside me that I was going to work on gun violence prevention, and I did, and I think with some good results. So follow passions like that. An uncle of mine passed away because he smoked too much, and my father was so upset about it, losing his brother, and that had a tremendous impact on me also. And my other piece of advice: follow your passion, but also know that this can be fun. This can be really fun and rewarding work. I love every day of it, going into the office and being with great people and talking with our coalition partners. Building coalitions can be one of the most rewarding things you'll ever do in your professional life. So if this is the kind of work you're interested in, please follow it.
That's great. Great advice, Vinny. And even if it takes a lot of time to develop those relationships and everything else, you are so right that it's so meaningful to the work that's being done, and even afterwards, it keeps giving back. So, all right, let's get a little bit more philosophical here, Vinny. So if you could revise or add one chapter to the DeMarco Factor book today, what would it be and why?
Well, simply it would be laying out the 6 steps as they're in healthcareforall.com/6 steps. I mean, when I was working on this book with Mike Perchik wrote it, a great man. He's passed away, but he's one of the heroes of advocacy. It's a great book, but it was only afterwards that the real 6-step process that I laid out before came to me. And I think it would have helped the book if that had been in the book.
You know, and I'm going to add my own chapter to it too about resilience. I mean, I think over your career, there have been many ups and downs. This is not something that is a sprint kind of thing. This is a marathon, and you've demonstrated that over your career. And what Jamie said, you won, you just didn't win yet. So important to today's viewpoint, given all the stuff that's happening at the federal level and all the rest. We'll find our way out of this. We just got to do our work. We might not have won yet, but we're on our way. All right, last big question. So if you could be remembered, Vinny, for just one sentence, what would you want it to be? When all this is done and you have finished. Say it again.
All is well.
All is well. Why is that significant?
It just means that we can deal with it. Whatever it is, we can deal with it. I'm not a panacea person. I know there are horrible things out there, but we can deal with it. And when we're working together, we can overcome the biggest obstacles. If you want to know more about that phrase, watch the Indian movie 3 Idiots, the Bollywood movie. You'll learn all about why all is well is my theme.
I love it. Love you, brother. So I think we're done with our part of this interview. I think we wanted to open up to all the folks who are here. So we turn it back over.
All is well is such a great phrase.
It is.
That's really
watch the movie.
I will. I like Bollywood, so I was like, oh, okay, there we go. I do already have a couple of questions, and again, if anybody else has additional questions, please go ahead and add those to the Q&A. The first one is, your campaigns focused on issues like tobacco control and gun safety. If you were starting out today, are there other areas you would focus on, and would you take any new approaches?
Yeah, it's a good question. Those are still very critical issues, and I would still want to work on them. But at the present time, my main focus is on achieving quality, affordable health care for all Marylanders and all Americans. And that's what I mostly focus on. But the 6 steps is still there, no matter what your public health approach to it is, whatever you're trying to accomplish. I urge anyone who's working on any of these tough public health issues to take a close look at healthcareforall.com/6 steps and see how that approach can help you achieve your goals.
And I did add that to the chat if anybody just needs an easy click.
And I want to say climate. Climate is something very, very important, and that we did use the 6 steps very successfully on a climate issue once, and we're going to do it again working with my son Jamie. So that's one issue which if I was a young person now, I would be deeply engaged in.
Yeah, as somebody who was around the DC area for quite a long time, the cleanup of the Chesapeake Bay is like
yes,
such a positive story.
Yes.
Another question. You often leverage unlikely partnerships like faith leaders and law enforcement. What lessons does this offer for forming cross-sector coalitions in today's political climate?
Yeah, it's a good question, and the important thing is to try to keep within your issue that you're working on and not let other issues get in the way of it. Best example is when I was working on national tobacco control issue with running Faith United against tobacco addiction. Um, we um, we reached out to broad faith leaders who wanted to reduce teen smoking. And that included some of the most progressive congregations and denominations in the country, and some of the most conservative. On the one hand, the Unitarians, on the other hand, the Southern Baptists, and we had testifying before Congress two of the top faith leaders in the country who at that time the Iraq War was going on. They were on opposite sides of that. They were on opposite side of so much else, but they came together to say we need to reduce teen smoking. We need this FDA regulation of tobacco, and that was very, very powerful. So don't let the other issues on which you disagree with people get in your way of reaching out to folks who want to be with you on the issue you're involved in. That was not without some controversy. There were people in the tobacco control movement who said, no, we can't deal with the Southern Baptists because we disagree with them on these other things. I said, wait a minute. They want to reduce teen smoking as much as you do, as much as you and I do. We need to work together. And I'll never forget, as long as I live, the head of the Southern Baptist, Dr. Richard Land, when he said, I said, thank you for coming, Dr. Land, during our press conference. I really want to do this press conference, and I wanted to say in my comments that the tobacco executives have cloven hooves, but my speechwriters wouldn't let me do it. But he was so into it. But the senator, seeing the most progressive and the most conservative faith leaders together made a big difference.
I do have another question, and while I really liked your single sentence, one of my mother's favorite things was good enough. You can take things really far, and then at some point you have to say good enough. So this person asked, can you say more about how to keep the first and second thirds marching towards the same goal? I sometimes find that the first third is sometimes singularly focused on perfection versus good enough. The second third is focused on good enough and can sometimes be seen by the first third as setting and or not committed to the cause. How do you keep those groups moving forward without losing them?
It's an excellent question, and you will probably lose somebody. Mm-hmm. So there is going to be a section of that first third who are, to use a word that Michael Perchik, the author of DeMarco Factor, taught me, a fabrenter, someone who makes the perfect the enemy of the good. Mm-hmm. And for all, I respect these folks and I respect their goals. They will sacrifice progress in order to hopefully, they hope, achieve some major outside goal. And if that's your attitude, you're not going to be part of our coalition. So you will lose some of these folks who will not compromise at all. But what I have found is that the most of the people in that first third, if what you're proposing is substantial, it's not just a Band-Aid. If it's something substantial, like a big increase in the tobacco tax or prescription drug affordability board to really make high-cost drugs more affordable, they will stick with you. And the third in the middle, as long as you stay without going beyond the scope of what they think would hurt them, they will also stay with you. It's always a balancing act. And I think the most important thing is to keep the coalition informed. As you hit obstacles, as you have to make changes, make sure the coalition is informed, is engaged, and they feel like they have the input into what the broader group is doing. But it's very, very important for this process to work. It's very, very important that at the beginning, when you write that resolution, it's something strong and that people are really engaged with it.
There's a similar question, and I guess I'd like your thoughts on how does your emphasis on message discipline align or conflict with the diverse priorities and voices often found in these public health coalitions?
Yeah, that's a very good question and well put. Message discipline is critical, and I think it helps when the goal of the coalition is within some confines, like prescription drug affordability, building this prescription drug board and giving it the power to do. Drugs don't work if people can't afford them. It helps. The broader what you're trying to do is, the harder it is to maintain that discipline, and you have to have different voices. But the beauty of doing a resolution document is everybody sees ahead of time the problem we're trying to solve and how we're trying to solve it. Very, very, very important. And related to message, I want to just emphasize one thing. It's important on issues like healthcare coverage that we talk broadly to people and not focus. We have to talk about the harm to people who are uninsured, but we have to talk about the fact that we all suffer when uninsured people go to the hospital, and we all, as a result, have higher premiums. And when you talk about things like that, this is what our former House Speaker in Maryland called the hidden healthcare tax. That helps keep your coalition together when they're talking about how everybody's benefited by what you're talking about, not just one group of people.
Great. And then I have just one more. Remember, everybody, if you have any questions, go ahead and add them. Can you tell us more about your use of data and personal stories together? And how can public health professionals balance both in making compelling cases for change?
Yeah, you're absolutely right, questioner, that you got to use both. You have to show the individual stories. One of the successes of our prescription drug campaign was people who would say, I had a good job and I was taking this medicine to do something about my ADHD, and then I got divorced. I couldn't take the medicine anymore, and I lost my job because I couldn't afford the medicine anymore. That was very powerful. That hits people with something that could happen to them. But at the same time, you got to have data showing that 1/3 of the cost to insurers of the premiums that you pay is drug costs. So your premiums are going up higher than they should be because the drug costs so much. So those two are, I think, good examples of individual story and data that both hit home to people. Use them both.
Great. Thank you so much. Any final words before we close this book club session?
I think my final words for everybody is pay attention to those 6 steps.
Yeah.
It doesn't matter if you're an epidemiologist, a biostatistician, or any other part in the public health field. Like, there's a role for you in these campaigns. It might be how you translate data into something that is actionable by an advocate, or you can volunteer your expertise. So when the time comes, if you're a faculty member at a school, working with advocates like Vinny and others to make sure that your expertise is loud and heard, and supporting policy that's moving forward is a really big deal. So don't think that this is something like you've got to quit what you're doing and go work and solely do whatever Vinny or other great advocates are doing. You have a role in your current expertise, in your current role that you are doing, to be a part of this.
Great. Anything, Vinny?
Just thank you very much. And it's a great thing you're doing for the public. Thank you.
Yeah, thank you both so much for being here. Thank you to the audience for being here. The recording will be sent out to the book club and also on our channel. So have a great afternoon, everybody, and enjoy your weekend. Thank you.
Thanks. Bye-bye.